Welcome, everyone. My name is Tori Vandelin with Prevent Connect. You are here for our web conference today, Trauma-Informed Principles Are for Everyone, Supporting and Sustaining Sexual and Intimate Partner Violence Practitioners. Prevent Connect is a national project of Valor US, formerly known as the California Coalition Against Sexual Assault, sponsored by the US Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the US government, CDC, or Valor. So we have a handful of objectives for our time together today. We want you all to be able to describe trauma-informed principles that are crucial and applicable outside of mental health services and crisis response settings. A lot of times when folks see trauma-informed, their minds go to mental health services and crisis response settings, but as our title shared earlier, trauma-informed principles are for everyone. So we're going to talk about what that looks like today. We also want you to be able to identify connections between organizational culture change and trauma-informed sexual and intimate partner violence prevention. And then we'll have an opportunity to discuss organizational culture change that supports these trauma-informed principles and that embodies sexual and intimate partner violence prevention in action. And Ashley, I know that this has been kind of an emerging and popular topic even outside of the work to prevent sexual and intimate partner violence. So can you let us know kind of how this topic came to be and what we were inspired by today?
Yeah, for sure. Thank you so much, Tori. Well, I think to answer your question, we really want to start this conversation by acknowledging some of the current conversations happening nationally regarding workplaces and the sense of burnout. There's really been kind of a surge in news articles about trauma-informed workplaces over the last couple of years, which, is really great to see. And there's a couple examples on this slide, and we'll post the links if you wanted to read some of those articles. But, we know that creating environments, including work environments, where people feel safe, supported, and seen for, really their whole selves, can buffer against trauma rather than kind of adding to it. And I think that it's important to acknowledge that long-standing social inequities directly impacting individuals as well as whole communities, plus the COVID-19 pandemic, have really been driving workplaces to look at their practices, policies, and organizational cultures more recently. And Tori, if you'd go to the next slide, I think at the same time, we are being faced with what you all are probably hearing called in many circles, the Great Resignation. And I was looking up the numbers this morning, and it's something like over 4 million people quit their jobs in the US just in August. And one of the theories behind the Great Resignation is that it's burnout. People are burned out, right? But new research is uncovering that the bigger issue seems to be what can be described as a broken culture of work. And instead of people wanting, like an extra mental health day here and there, we're seeing people demanding things like the pay that they deserve. We see people no longer willing to work in toxic environments and people really wanting more flexibility. And Tori, if we go to the next slide, our presenters today are really going to take a deeper dive into trauma-informed principles and what they can look like in practice. But my invitation to the rest of us is to think about how organizational culture change to support trauma-informed principles, like the ones on the screen right now, can really embody sexual and intimate partner violence prevention and also sustain people who are actually, doing that work. Preventionists, prevention practitioners. We don't often talk about trauma-informed principles. When we talk about prevention, it's an area that can oftentimes be pretty siloed. So that's my invitation today. And to kind of welcome you into that conversation, we wanted to start off with a text chat. And so this is our first question that we invite you to think about, and we'd love to hear your answers to see what's coming up for you. And that is, what are your ideas for fixing the broken culture of work and advancing sexual violence and intimate partner violence prevention? How do you see one supporting the other? What are your ideas? If you could make all the decisions today, how would you fix the broken culture of work? And feel free to take some time to think about that. I think what we'll do is we'll introduce you to our guests, and then we'll come back and see what people are saying. I am seeing things come in right now, which I'm really excited to go look at. But I do want to introduce you all. So we have a fantastic panel of guests today. You are going to be hearing from Madison Hammett, from Courtney. Courtney, I should have asked you how to pronounce your last name because I probably am going to say it wrong, Calixte. Brooke Taylor and Katie Moffett, and Courtney, you will have to correct me and share that when you have a moment. But let's see. We're first going to talk, Madison, to you. And Madison, I know that you are working at Illinois ACEs Response Collaborative, and so we'd love to hear more about that. We'd love for you to tell us a little bit about, what is the Illinois ACEs Response Collaborative, and really how you're helping health departments become more trauma informed. So Madison, I am going to turn it over to you.
Great, thank you so much. And thank you everyone for joining us today. I'm really excited. And I'm really excited to see all of the stuff y'all are typing in to this chat box, because a lot of it is stuff that we are going to cover and talk about. I am Madison Hammett. I am a senior policy analyst and the manager of our capacity building supports here at the Illinois ACEs Response Collaborative. And we actually have a couple of introduction slides so I can tell y'all a little bit about who we are and what that means. So we can head on into our next slide. So here is our mission and our vision. So as you see, our mission is to catalyze a movement to prevent trauma across the lifespan. So those of y'all who are familiar with the Adverse Childhood Experiences Study might recognize that ACEs part, but we really look at trauma beyond childhood throughout the life course and indeed into systems and larger structures that we all live in. And we want to both prevent and address that on a multi-system level here in Illinois, but also with partners throughout the region and the country. And we do that through three methods. The first of which is policy and advocacy. So that is big P policy with our legislators, and advocacy with folks like our governor and our lieutenant governor, our representatives. But we also do little p policy. So looking at organizational policies, looking at structural policies. How do these influence outcomes around trauma, around adversity, and how our outcomes are affected by those. We do capacity building, so we do trainings, presentations on topics like organizational building, but as well as historical and structural trauma, for example, burnout and secondary trauma support, things like that. And we also provide technical support to health departments, healthcare organizations, and social service organizations. And then we work on research, translation, and dissemination. So we look at these big research projects that are being put out, like we've already talked about today. This is a very hot topic, but we want to figure out how can we make sure that everyone knows that this is applicable for everyone. This is not just something for mental health care professionals, social service folks to care about, although we certainly want y'all to, but we want everyone to know you can be a trauma-informed workplace regardless of the type of work you do. So that is a big motivator for us in spreading this information throughout Illinois and the region. Go to the next slide. So before I do anything else, though, before we start talking about any of the statistics or methods, I always take a second before every presentation to acknowledge that we are talking about trauma. And this is a really difficult and hard subject to talk about. And so I want y'all, I'm so thrilled to see so many people here, but I also want to acknowledge that it is hard to sit through a presentation, even if it's online, about this really difficult topic. I know that this is y'all's work, but I want to encourage you to take care of yourselves during this presentation. So for me, that means, if you need to turn off your video, if you need to step away, I know we're recording, but you're also welcome to follow up with me after anything you see here. And I'm happy to connect more with it. Just because I want to acknowledge that this is a really tough topic to talk about. And just like specifically, we will be touching on things like abuse, child abuse, sexual abuse. We will be talking about trauma in the workplace and burnout and larger systemic issues like racism and xenophobia, sexism, all of these things that contribute to our well-being. So please take care of yourselves in the best way that works for you. So I just wanted to take a moment to acknowledge that. Slide. I also want to take a second to acknowledge the language I'll be using. So we at the collaborative use the words trauma and resilience because those are the words and terms most commonly used in peer-reviewed literature. However, those do not always resonate with people. I know that this is an audience I don't have to tell this to, but a lot of people don't like the word trauma and applying it to their own experiences. A lot of people don't like the word resilience and the connotations that has for some people. And that is absolutely fine. And we absolutely encourage you in your work to use the words and terms that best resonate not only with the communities that you're serving, but also each other as staff and coworkers. So that might be adversity, that might be thriving, that might be, for some people, grit and determination resonates better. All of those are great and fine. And if you have other phrases or terms you like to use in your organization, please share with us. We're always wanting to know more about how folks are doing this work. Because I want to note too, a lot of people are doing trauma-informed work and not calling it trauma-informed, or not recognizing or realizing that it fits into SAMHSA's idea of trauma-informed work, or these kind of narrow phrases and terms. So please, throughout my part of the presentation at least, please feel free to share any different language pieces you use. I also, on the role of language, want to note, I am a cis white woman, and my presentation is influenced by who I am, my experiences. So, I don't know everything and I might get something wrong, and I am here just as much as you are to learn. So if you feel safe and comfortable, please do not hesitate to either in the chat or reach out to me afterwards, say, something that you would change or something you'd like more clarification on, because again, we are always learning and wanting to make this better. So at least from my end, I hope that you feel safe and comfortable enough to put that forward. But if you would rather do it after the presentation, I am again happy to connect with folks. So thank you. I will go on forward.
Madison, I wanted to just ask you if you could share, it looks like that's exactly what you're about to do, how you describe what it means to be trauma-informed, and then also maybe some elements of trauma-informed policy or practice.
Absolutely, yeah. So we are going to start off by defining trauma, but then we are going to jump right into what does it mean to actually be trauma-informed. And the reason we start off with defining trauma for folks is, this is a fairly self-selecting crowd. You're all very experienced in this sort of thing, but we also recognize, and y'all said this earlier, these ideas have sort of permeated popular culture for particularly the last 18 months or so. And so when we say trauma-informed, we are talking not necessarily about something that is a responsive clinical practice, but rather this acknowledgement of trauma and its pervasivity and its intensity throughout our culture, and how organizations then can create safe and supportive spaces for their staff, but also the people they serve, community members, et cetera, and how you can do that, not necessarily even changing who you are as an organization or your day-to-day practices, but more of a reframing of that. So, but to start us off with this definition of trauma, You see here that we say it's this threatening, harmful physical or emotional experience. What we think is really important are these two second pieces from SAMHSA, and that is overwhelming our ability to cope and affecting functioning in multiple domains. So, and again, this is probably old hat for most of y'all, but we don't think of trauma as this linear event, right? Where you've had this event that's happened to you, and this can be a single event, like an assault, a car accident, or it can be a series of events, domestic violence, for example. And then you have an experience of, this is how my body is experiencing it. And then you have the long-term or short-term effects. We view this as a cycle, and something that can be experienced all at once for people, out of order. It feels more intense at some parts during the day and others. And so I mentioned that and its relationship to organizations too, because a lot of times, in our culture, we have this idea of like, oh, well, I have 9 to 5 and I've clocked out. And so if I can just put things aside while I'm here, that'll be fine. But we all know that's not true. So it's particularly important for organizations who are looking to embark on this trauma-informed work to really keep this idea of trauma in mind, particularly those last two of overwhelming our ability to cope and affecting functioning in multiple domains. So this is physical, emotional, mental, all of these pieces that make us who we are. And so it's important to remember this, because we can't then expect people to somehow turn it off when they come into work. But in our next slide, we're going to talk about how this is particularly important in relationship to burnout. So burnout is this state of physical and mental exhaustion that's specifically related to the workplace and its related environment. And again, I emphasize that because burnout is another term that's gotten a lot of play over the last 18 months. And I think rightly so. We talk a lot about it with regards to the healthcare world, for example, with the social service world for the last year and a half. But it's particularly important to remember that it is connected to the workplace, because we then have to look to the workplace as a place that gets solved. We can't just tell people, oh, we'll take a self-care day and take the day off work and that will cure your burnout. We have to look at this as an organizational issue, and one that organizations have to implement changes to address. And it's important because we know it affects huge swaths of the social service world. So even before the pandemic, 33% of social workers reported that their work is always stressful, and 4 out of 10 said they planned on leaving the field within 5 years. And since March of 2020, those burnout symptoms have risen to 60% of social workers. And I think that part about folks saying they're planning on leaving the field within 5 years is incredibly important when we think about organizational health too. How do we ensure longevity of care, of practice? How do we ensure that clients, community members are getting the best care that we can provide if folks are leaving rapidly and very quickly and aren't able to provide that institutional knowledge to the folks coming up because they are burnt out and they're trying to take care of themselves? And we're going to talk more about this connection to diversity, equity, inclusion, and how these systems play a role. But we already know that this affects already marginalized groups at a higher rate. Women and non-binary workers report higher levels of burnout than their male peers. And reasons included, this potential risk for family members, but also because we have we put a lot of responsibilities on women and non-binary workers. They have their dual shifts. So you go to work and then you come home and you have to do your second job of taking care of the home. There's also a lot of responsibility placed on women and non-binary workers and people of color of all genders to be mentors, to take on this extra burden of being diversity experts, when that's not their job, to also have to, kind of figure out, do I address these equity issues within my organization that are impacting my health and well-being? Or do I let it slide because I know that that might create conflict, and that creates this additional stress, this additional burden. And so as we're going to talk about throughout, we at the collaborative in our work, we really emphasize that this trauma-informed organizational building cannot be separated from these ideas of racial equity and justice and equity on other levels like gender and sexual orientation, because we have to address these larger systemic issues to take care of individuals. And that's particularly important because we know that Black and Latinx workers of all genders report higher levels of burnout than their white peers. But interestingly enough, in this mass survey that was done, we're also more likely to report feeling connected to their clients and community and continuing to find meaning in their work over their white peers. So this also tells us that organizations are not learning from these groups. They're not actually taking the knowledge that they have and the connections that they're building and using them to implement these equitable policies. And so that's a real opportunity for organizations to look within and say, what strengths are already here? And what, resilience, what trauma buffers do we already have in place as individuals that we can then utilize on an organizational level? Slide. So then what does this actually mean? What do we actually do with this, sort of heavy information? And that's where this idea of building resilience as an organization comes. So resilience is this process of adapting in the face of adversity using mechanisms that don't cause further harm to health and well-being. And I really emphasize that second part because we at the collaborative, and I'm a clinical social worker, I really reject this idea of maladaptive behaviors. People adapt to the environment that they are in, right? And our bodies, human beings, we are incredibly resilient. We are focused on survival. And so we do what helps us survive in that moment. And then we run into conflicts when we are in environments that are no longer suitable for that survival mechanism. So if we have someone who was raised in a household with a lot of chaos, who might have seen domestic violence growing up, who might have seen, had a lot of instability growing up, their survival mechanisms are going to be very different than someone who wasn't raised in that environment. But we cannot then expect them to suddenly do away with those survival mechanisms immediately. Those are learned behaviors, but we can provide supportive environments to learn new behaviors, to learn new ways of surviving, and learn that you are safe and you are taken care of and supported, because resilience is not a moral judgment. It doesn't mean that you've somehow figured something out that nobody else has. It doesn't mean either that you haven't experienced harm or trauma. I think a lot of times when folks hear the phrase resilience or hear this idea of resilience, it's often connected to this idea of, well, you're really tough and you just let things slide by. You don't get bothered by things. And that's not what we mean when we say resilient. We mean that people who have these skills, who have been, either raised in or provided an environment that shows them that they are respected, that they are cared for, that they are loved, those folks are able to be in bad situations, but recognize a way out, to say, I know this isn't right, and I know how to get out of this situation. I know how to take care of myself in this situation. And we spend an enormous amount of time at work, and so when we say that organizations can build resilience, it's because we are spending a lot of time in these environments and learning every time we are there. Every meeting you have with someone, every time you say hello to someone in the break room, you pop in to ask a question, those interactions are actually teaching you how to build these resilience methods, because just like the trauma that folks experience, resilience is seen and experienced along this continuum. And so what is resilience for me isn't resilience for someone else, maybe vice versa. But we also know that there are ways that organizations can create an environment that encourages this with all folks. And it can be taught and nurtured across the lifespan. Those of you who work with kids or have a background in child development, you might remember that we really emphasize early childhood as a time that we learn a lot of our social skills, a lot of our relationship building skills, and that is absolutely true. But those don't fade into nothingness as we get older. We are always learning and nurturing and teaching each other things across our lifespan. And so organizations actually have an enormous influence and can create these skills for their staff members. We can go to the next slide. So how do we actually do that then? So what are trauma-informed practices and policies? So trauma-informed practices and policies are TIP, are just kind of a reframing, and it's a new way of looking at the work that we do. So an organization utilizing TIP understands and considers the pervasive nature of trauma. So you have done that simply by coming to this presentation. You have recognized that trauma is an issue and something that you want to address, and promotes environments of healing and recovery rather than practices and services that may inadvertently re-traumatize. And so that second part, I think, is particularly important when we're talking about staff members, because often TIP focuses on outward facing things. What do we do for our clients? What do we do for the communities we're serving? And that is absolutely important. But we also need to think about, well, how do our practices and the services we provide staff, how do those go into playing into people's trauma? How do those perhaps emphasize or re-traumatize people? Because we know that staff members, they have their own lives, they have their own histories, and that doesn't just stop at when they clock in for the day. So it's not just about promoting that environment of healing for community members or for clients, it's also thinking about how do we do that as an organization for our staff members. Because utilizing TIP means that you recognize that direct impact that trauma can have on access to services. And when we say services, we're going to talk in a couple of slides about some concrete examples that folks have done. But one thing that we really emphasize with this trauma-informed work is it is not just enough to have things written down as a policy or on paper if you are not an environment that has changed to make the accessibility of those policies paramount. So, for example, paid leave. If you have unlimited paid leave as a policy, that's great. But what does the culture around that look like? Do you have an environment where, when people want to take time off, there's systems in place to make sure that their work is taken care of, or that they feel like they're not going to be judged or have a punitive response? When people need help, are there mechanisms to get that help? So it's not just about providing a service to staff or providing a policy. It's about changing how that policy is accessed and the culture around that policy, because it's integrating that knowledge about trauma into all aspects of services. And we really emphasize training all staff around this idea. So very often when organizations are looking to become trauma informed, and we've touched on this already, this idea of, well, that's for our mental health workers, or that's for our social service team. It is not. It is for everyone. You can be a trauma-informed accountant. You can be a trauma-informed environmental services specialist. You can do all of your work that you are already doing in a trauma-informed way. And that is just through recognizing these signs and symptoms of trauma, of recognizing that policies impact how people experience the organization, and recognizing that there is a way to make this more accessible to folks. And I really want to emphasize, I know we've talked about it already, TIP is not, the purpose of TIP is not to provide psychological care. When we have done our organizational support, that's something that comes up a lot, particularly I think with our medical folks who will say things, like, well, I'm a dentist, I'm not a psychologist, I'm not a social worker. I don't want people to feel like they have to tell me things or disclose things that I'm not ready to hear. Or if you're an organization and you put this out there, we want you to make sure that you have responses in place if you're going to ask hard questions. That's not what we're emphasizing, though. We're talking about providing the services that you are already going to do in a way that is accessible to and accepting of those who've experienced trauma. And again, we find that organizations really connect with that on a community level or a client level, but we want folks to do that on a staff level too. So are you accepting of staff members whose survival mechanisms, whose adaptations might be running into conflict with the environment that they're currently in? And we're going to talk a little bit more about like how you actually do that, but just really want to emphasize, we're not asking anyone to become a psychologist or a mental health care provider if that is not your job. We can go to the next slide. Because what we really want to emphasize is that this work is all about shifting our perspectives from what's wrong with you to what happened to you. That is the biggest thing that you can do. And when we say this, we're going to talk a little bit about like this idea, for example, of providing choice, of collaboration, those elements. That is a big part of this. And I think sometimes when people hear that, it kind of brings to mind this idea of like, well, I'm just going to have to change everything I do, or that means I'm going to have to let, staff or coworkers say whatever they want or do whatever they want. And that's not what we mean. We mean instead, when conflict arises, when people are dealing with stress, when you see things happening within your organization, the, immediate reaction to that might be like, what's wrong with you? Why can't you show up for work on time? You're supposed to be here. We've got all this stuff to do. We've got all this paperwork to do. Why can't you get it together? And that punitive response is a reaction to someone's adaptation of their environment. So instead of framing things that way, it's what happened to you. So an example I always give is if you are a manager and you have someone showing up late for work every single day, your response to that might instinctively be like, what's wrong with you? You're supposed to show up to work on time. If you keep being late, I'm going to write you up. I'm going to have to let you go. And instead the reframing might be, what's going on that's making it difficult for you to get to work on time? Because that opens then a conversation about, again, acknowledging that people are people outside of an organization, but it's also then asking folks to talk about what's right with you. So what are folks' strengths that you can identify? Those conversations around like, well, here's what I've been dealing with, and here's what I've been trying to get right, and here's what my priorities have been, and that's why it's been difficult. That leads us to a much deeper conversation about what matters to people, what's important, where do our personal goals align as individuals with an organizational goal? And then that idea of what can we then accomplish together? Because and I know I don't have to tell this crowd this, we know no one is a bigger expert in their own lives than the individual. And that's true for their work too. No one is a bigger expert in how to be their best at work than that individual. It's up to the organization though to actually ask that person then, what do you need to be your best? So we do that through TIP. You can go to the next slide. So how do we do that then? So SAMHSA utilizes the 4 R's. So realizing the prevalence of trauma, which you have all done by coming here today, but we know that trauma is incredibly common in the United States. the Adverse Childhood Experiences Study, which was a mass study that looked at 10 common causes of adversity in childhood, including neglect, abuse, and household stress, like incarceration of parents or interactions with the foster care system, found that 60% of Americans have at least one childhood trauma. Of the total population in that original study, for example, it found that 25% of women and 21% of men reported childhood sexual abuse. And we know too, for example, that every 68 seconds, someone in the United States is sexually assaulted. So trauma is incredibly prevalent, and that includes within staff. And so we cannot separate that idea. We cannot say, well, we're trauma informed because of how we take care of a community. It also has to be, we're trauma informed because of how we take care of staff. And that comes into this idea of recognizing how trauma affects all individuals within a program. It affects our family members, it affects the folks that we see on an individual basis, and it affects us. And, you know, even if we are not survivors, we know someone who is a survivor of trauma. And we actually have to put that knowledge into practice with staff members. Again, it is not enough to have organizational framing that is only addressing community members, that is only addressing our clients. We have to then think about how does this affect staff, because our goal should be to resist re-traumatization of clients and staff. And so that means then acknowledging that work can sometimes be the origin of trauma. And so for organizations that are looking to do this, long-term organizational transformation to actually look at their policies and practices, it means thinking too about, well, how in trying to create a safe space for clients and communities have we, however inadvertently, might have caused our staff to feel unsafe, might have caused, the folks who are responsible for taking care of others to feel as if they are not taken care of. We can go to the next slide.
Madison, I wanted to just pop in really quick. And first of all, something that you said a few slides back around like providing an environment that nurtures resilience. It seems really critical to me in being able to get to our work around primary prevention. So I've just been kind of like pausing on that point. And now I'm just wondering if you could talk about like how do we integrate trauma-informed principles so that they really become like built in to the fabric of our organizations?
Yeah, absolutely. Yeah. So here, that's actually a perfect segue into this slide. So how do we integrate this into the fabric of organizations? So we've already touched on the 6 elements that SAMHSA put together for trauma-informed organizations. And we have an example here of how we have done that with organizations here at the Illinois ACEs Response Collaborative. And you will see one is missing from the slide. And I do have some backstory on why that is. But we're going to start with this idea of establishing safety. So what does it mean as an organization to establish safety? Well, for your clients, you might think about that as like, I'm going to make sure my clients feel safe here. I'm going to make sure that their physical environment feels safe, and repeating those safety assurances and non-judgmental stuff. That is true for organizations with staff as well. So think about it as an organization. Does the space where we ask people to work, is that physically safe feeling for them? And this can be as simple as the position of seating within the office. Some people feel safer when they can see a door. Have we taken that into account for our workers? Do people feel like it is well lit and that they have, access to the parking lot in a safe way? That sort of thing, but also emotional safety. So this idea of non-judgment, shifting from what's wrong with you to what happened to you. Do you provide as an organization a space for reflective supervision or reflective meetings with management or supervisors? And when people come to the organization with troubles, like I have this really difficult case I'm working on, or I'm feeling really overwhelmed by my work right now. Do people feel like I am going to be able to talk to my manager, my supervisor, whomever, about this in a way that is safe and supportive, and I know something will be done, and I'll be presented with non-judgmental responses. And have you as an organization prioritize that for your staff? And I think the real key part of that is starting with this idea of unconditional positive regard for the person in front of you. It is very easy to say something like, oh, we'll just assume the best of people. But are we actually practicing that as an organization? When someone comes to you and says, I'm really struggling with this client, with my caseload, with whatever, are you reacting as an organization in a way that's like, well, that's just kind of how it is, we've all got work? Or are you actually taking the time to, acknowledge the underlying feelings behind that, of feeling as if you're not being supported, of feeling like you need more work, or more support around your work? And that ties into this idea too of being trustworthy. So we always say, obviously don't make promises that you don't know you can keep, but being trustworthy also means, being transparent, letting people know this is why we do things the way we do. This is why we follow this policy. Here are the boundaries we have as an organization, and not sugarcoating it either for folks. So being very clear and transparent. We have found overwhelmingly that people prefer to have clear bad news given to them than opaque maybes. And so it's really important for organizations to be as clear with their policies and the reasoning behind them as possible. So that means then providing choice, though, of saying, this is why we do things. What is the best way to get to our goals together? This is why we do it the way we do. Does that align with your practice? Do you have new ideas? So again, this isn't letting people do whatever they want, but actually just acknowledging that expertise. And that again ties in with this idea of collaboration, reinforcing autonomy and reinforcing the expertise of everyone within the organization. So we recognize hierarchies have to exist, but we have found that organizations that have regular meetings where all staff members are invited to contribute to policies and practices are much more successful in preventing burnout than ones where managers kind of just give orders down from on high. And that goes into this idea of empowerment. And I know that's a sticky word, but when we say empowerment, it is again that recognition that everyone already has power within them. So we as an organization then make space for that. And I'm going to close with some examples of that on our next slide that we have seen folks operationalize. So when we say limiting work hours and offering flexible work arrangements, I acknowledge, some places have to be open from a certain time to a certain time. If you work at a shelter, someone's always got to be on duty. So it may not be possible to do summer Fridays or something like that. But when we say limiting work hours and offering these flexible arrangements, we mean the acknowledgement that people have lives outside of the organization. So when folks have things come up like sick days or child gets hurt or need to take care of mom or whatever it is, do you have a process in place for people to feel safe taking those days? Or is it, oh man, Bob's got to take the day off. We've all got to scramble to cover his work. And there's a lot of agony and anxiety around taking a day off? Or is there just a process set in place? And it also means modeling that behavior too. So that's where this investment in leadership development. And here it says supervisors, but we also mean leadership within an organization as a whole. So who are the folks that have a lot of, cultural knowledge about the organization? Who are folks that people listen to, who they see as experts? And are those folks being pushed forward when it comes time to talk about policies, when it comes time to talk about the growth of an organization? We've also helped folks establish wellness committees. And when we say wellness activities, we don't mean necessarily free ice cream in the lobby, although that's certainly nice. We mean more like actually investing in responsive activities. So if someone says, you know, like we're really struggling with our workload in this part of the organization, that means then figuring out how as an organization you can provide the support for that, if pulling people. And so that's why it's really important to have everyone from the organization work to establish this wellness as a quality indicator. And it's not just the social worker's job or HR's job, but in fact, everyone. So one way we've seen that done is a regular pop-up on their intranet where people just answer 5 quick questions about how their month has gone. And then that makes the responses that much more immediate, and it doesn't feel like a waste of folks' time. You can go to the next slide to close out. And so how do we actually do this? So we have hosted facilitated discussion groups, which yes, have these elements that you see here, but are also just venting sessions. So are you providing a safe space for folks to come together and say, this is what I'm really struggling with, and I just need to talk to somebody about it. And it doesn't have to be a clinical approach, but rather this, again, feeling like you're understood, feeling like you're safe to expose as yourself and be vulnerable. And that comes with establishing this culture that prioritizes all relationships. So I recognize someone's got to sign the paperwork at the end of the day, someone's got to sign off on a grant, but are you actually asking people how to be a better organization for them as workers? Are you asking people only, how can you be a better worker for us? It's a two-way street. And so asking people what they need and having those regular check-ins is really paramount to getting this on the started. Supporting expressions of compassion. So we, as mental health providers, as social service providers, I think are really good at outwardly providing this for folks, and then inwardly within our own organizations, not doing that, and really running ourselves ragged and pushing ourselves to the breaking point. So when we provide these emotional supports, are we also providing a culture that says like, yes, we want you to do that. We want you to take advantage of it. Because again, having something on paper and then saying, oh, well, Bob has to take all these days off isn't actually providing any support. It's providing that judgment and that unsafe environment. So thinking about, well, how do we then encourage each other to do that and to take care of ourselves? And that includes coming up with mechanisms to address any missed work and being okay with that. And then I know we're going to talk more about this, but we really emphasize that trauma-informed care does not exist without racial justice. And the same goes for TIP. You cannot have a trauma-informed organization if you are not looking at the larger social and systemic issues that influence people's trauma and outcomes. And so that means also doing some diversity, equity, and inclusion work and looking inwards about who is getting a voice at the table. And all of those elements we've talked about, are they being framed with this racial justice piece in mind?
Thank you so much, Madison, for providing such kind of like a broad understanding of what trauma-informed practices and principles could look like in an organization. It was a lot of information, and it was so helpful kind of establishing kind of broadly what this could look like. We're going to actually zoom in and see what this could look like on kind of a more focused scale in implementation and in practice. But we do want to hear from you all in the audience. What are your thoughts? What would this look like for a trauma-informed organization to really support prevention specifically? What would that look like? You have some really great examples, and I actually, Tori, want to ask you for like a 1-minute highlight of responses of what folks were saying to our first question.
Thanks, Ashley. 1 minute's going to be tough, but I do want folks to rest assured that we will make the text chat transcript available within a week or so after this web conference. You can go back and see everybody else's inspiration too. But I really appreciate, folks were bringing up a lot of these root causes of how we got to this broken culture. Folks were recognizing specifically in our work, a need to decolonize the work, to maybe think outside of the constraints of capitalism about what it means to have your needs met, whether or not you're in a job. Folks also commenting how a way that they would fix the broken work culture would be to not restrict benefits to working 40 plus hours a week, so folks can really be more flexible. I saw a lot of stuff about pay equity, paid leave, childcare, a 3 to 4 day work week, and a lot of what was said about workload, sustainability, and recognizing the whole person of who each of us are and who each of us work with really echoed a lot of what Madison had just shared too.
Awesome, thank you. And I see some great comments coming in regards to the second question. We'll circle back and get to those in a bit. But now I'm so excited to introduce you all to our next guest. I want to introduce you to Courtney, Brooke, and Katie, all from the Virginia Sexual and Domestic Violence Action Alliance. Courtney, Brooke, Katie, welcome. Thank you for being here. I'm going to hand it over to you, and I'm wondering if you could first tell us about the project that you all are working on called the Underserved Populations Learning Collaborative, from here on out, UPLC. And I will hand it to you all.
All right, thank you. I'm going to start us off. I'm Courtney Kellixt. There's my pronunciation of my last name. So yeah, I want to talk to you all about the project that we've been working on. As you said, the Underserved Populations Learning Collaborative. What I'm going to do is frame kind of like the background of the project and how it got started. And hopefully you could pick up some of those trauma-informed, culturally responsive, racially just things that we did in the process of making the project. So as you can see on the screen here, the mission of the project is to support local and domestic violence programs and sexual assault centers to become strong allies to underserved populations and to promote access to culturally responsive, comprehensive services. Now, this sounds really survivor focused, and it is, but there's a good portion of the project that is really focused on organizational change. And you hear more about that later. So while this mission seems really important, you'll hear more from Katie and Brooke about the meat of the things, but I'm going to tell you about the bones later. So before we got to this mission, as I mentioned, oh, can you change to the next slide? I'm sorry. Before we got to this mission, I would like to say that some folks from our agency, the Action Alliance, our funders, the Virginia Department of Social Services and their Office on Family Violence and the Department of Criminal Justice Services, their victim service division came together to discuss this partnership before it even became a project. And I mentioned that the Virginia Department of Social Services and VDSS, you'll hear me say that, and DCJS, Criminal Justice Services, they're our funders. I have to say that because they funded the project, but in making this project, we decided to become, in some ways, very equal partners in construction. So that speaks a lot to that collaboration piece when we're doing this hard work and having the hard conversations. So prior to January 2018, before I got onto the project, folks, they were talking, leaders in our agencies, respective agencies, were having conversations about the needs assessment you see up here, the results of that needs assessment, and the results of the sexual assault demonstration initiative and the best practices there. And they were also talking about who's getting left out of accessing services. And when I came on board, the process in January, we hit the ground running, and that's January 2018, of course, and to talk about what our partnership could look like. What we were researching models of how we were going to do this, then we figure out what bones of a project could look like. And then that's how we came to the mission you saw on the previous slide. We developed that, and we developed learning objectives, the format, and we determined that folks should really get a stipend for participating in this to limit the barriers they may have for travel to this project. So we did all of that. And then what you see on the screen here is kind of like the model that we created. There's like, it's a 24-month project. It started out at 18 months. We got probably to, I want to say at the 12th month, and we were like, look, we are teaching on people all these things, but we need to walk them through some of the concrete things they could do. So we added another 6 months. So now it's a 24-month project. And what we were hoping, kind of like the meat of it, just the outline of that, is that folks we'd be asking agencies in this 24-month project to dig deeper into trauma-informed, culturally responsive, and racially just practices. And that's not just for the clients and survivors they serve. That is for them to focus on that internally as well. Because you know that sometimes the things that happen in our agencies also mirror to the way we serve survivors. So I wanted to highlight some of the influences, but not go too deep into them because you'll hear about that later. So the National Network for Trauma and Traumatic Stress, Child Traumatic Stress, excuse me. They have a learning collaborative, and we borrowed that model of having a cohort-based learning collaborative. Just like I say, we took some lessons learned from the SADI and the assessment tool. And I didn't put it up here, and I don't know how I forgot it, but we also used the framework of the 3-tier population framework from the Women of Color Network, and that really guided some of the work that we needed to understand the project. So yeah, the last little bit, the format, 24 months, is loosely based on the social ecological model, doing internal reflection, community work, and internal like personal reflection, internal or agency reflection, and then community level work. And I'll also say that this cohort, this is our second and last cohort, and our funders and our agency are part of the cohort. So we're trying to get to that outer ring, like larger policy, larger statewide work that needs to be done with that racial justice and so trauma-informed practices as well. I think that's it. I think that's all I have for the bones of things.
Thank you so much, Courtney. It's so great to hear kind of how you all, the process that you went through and who your influences were and what the project actually, the format that it follows. So thank you so much for sharing that. Really appreciate that background. I'm wondering, so I know that in our conversations, UPLC is really intentional about addressing the cultural, racial, and gender aspects of being trauma-informed. So I'm wondering if you all would talk a little bit about how addressing equity has shaped this project.
Yeah, I will be taking this little portion of the conversation. Thank you for advancing the slide. Hi all, I'm Katie Moffitt, and I apologize, my dog hasn't made a peep until just now, so I'm hoping he quiets back down. So there are several ways that we have rooted ourselves in equity. So a little bit of the why. Back in 2008, there was a survey done, and the report that came out was increasing Virginia's capacity to serve culturally diverse survivors of sexual and domestic violence. So in this, they really were able to identify local programs' readiness to engage in this work. They found that about 51% of respondents already had some kind of written commitment to addressing racism in their mission or in their values. But then the 41% who didn't, of that 41%, 75% of folks said, but we want it to be there. So in that survey study, they were able to identify the readiness that was brimming to the surface for folks in this state. Next slide.
then Courtney, I got you. Women of Color Network. We were in conversation with them as partners and also pulled from portions of their STOP project, in which they identified the 3-tiered system for identifying unserved, underserved, and inadequately served populations, which are historically marginalized populations throughout our country and in our state. And what they found in this project, and what we've really tried to emphasize, is that a one-size-fits-all approach does not work. It will not reach, it will not impact, it will not empower or uplift folks if you're addressing everyone with the same formula. So next slide. And then to build on that, 2014 and 2015, there was a statewide needs assessment of unserved victims of sexual and domestic violence in the state of Virginia, which dug a bit deeper and went further into identifying what those common barriers were across the state. And so I'll just quickly go through those. Really, there's a distrust of SDV response systems in the state due to adverse personal or historical experiences with the response system and service providers. People identified a lack of coordinated, consistent, reliable, accessible, affordable, or culturally appropriate services. There was a perceived or actual consequence for disclosing SDV results, which resulted in them receiving or not receiving help. And then there was also a sense of minimization of issues across the state. So that's a little bit of the why we focused in on equity. We realized that in order to end violence, we have to work towards equity. So next slide, please. Yeah, because if folks
Katie,
aren't
can I?
Sorry. Yeah.
Can I? No problem. Can I just ask? When some of our conversations was really about like this idea of a culture shift, and so I'm wondering what kind of culture shift were you all hoping to see through UPLC?
Yeah, so actually this next slide really feeds into that. So what we're really hoping, and Courtney mentioned earlier, that we're hoping that people will do individual work, organizational work, and then, bigger societal community level work. And part of that is working to dismantle white supremacy. So we want folks to examine implicit bias and racism and the connections that those have to uplifting and supporting the continuation of sexual and domestic violence. So if we're going to end sexual and domestic violence, we must end racism. We must address and deal with implicit bias in ourselves, in our organizations, and in our systems. It's got to go all across the socio-ecological model for this to be effective. Next slide, please. Yeah, so just really big here. Want to emphasize this: anti-racism work is anti-violence work. We had that question at the beginning about how do we fix like the broken culture of work, and I immediately just wrote down dismantle white supremacy. That's what we got to do. When you think about that pyramid, when you think about the rape pyramid and all of the isms that support and allow domestic and sexual violence to continue, at the base of that is racism. We have to deal with that. And if we don't, we're not doing the work. Next slide, please. Yeah, so again, challenging those characteristics of white supremacy. A resource that we've used and distributed amongst both cohorts is the Dismantling Racism Works workbook that you can find online. It highlights the characteristics of white supremacy by Tema Okun, and walks through not only what they are, like perfectionism and either or thinking or only worshiping the written word. Not only does it like challenge those, like point them out, but it gives you ways to challenge them within yourself. And then how can you do that as an organization? And then even as you work out in the community. Next slide. Yeah. So again, you saw in the beginning, things around trauma-informed care, SAMHSA's 6 principles: safety, trustworthiness, peer support, collaboration, empowerment, and choice. And then we find that often the sixth one is the one that doesn't get as much attention. The fact that if we are doing trauma-informed care, if we are in fact weaving this into the fabric of our programming, that we must be addressing and taking into account cultural, historical, and gender issues. And next slide. All right, so here are some of the shifts. I'll pause for a second.
Hey y'all, I'm Brooke Taylor. I use they, them pronouns. Thank you, Katie and Courtney. So to finish us out, we're going to talk about some of the expected culture shifts that we're looking for from the UPLC project. And again, this is taking place across the state of Virginia based upon the Sadie. It was influenced by the Sadie project. And so the first thing that we're going to talk about, we really hope to see organizations highlighting or preferencing those who are most impacted and have oftentimes marginalized communities have the least amount of access to services. And so one key tenet of the UPLC project is to go out and really do outreach to folks that we don't typically reach within our STVA organizations. And so this can also be a sensitive subject when we're talking within our organizations, because what does it mean to be more impacted when we're all survivors, right? Like we're dealing with a community of survivors. And so that's actually a question that comes up within our work, is to say like, well, if we're out doing outreach to new populations, what happens to the people that we were already serving? Are we supposed to neglect the folks that we were already serving in favor of new folks? That's definitely not what we aim to do. But we are acknowledging that historically, there have been communities that have been consistently marginalized. And within our field, it's our duty to reach all survivors. And so one of the key hopes of the UPLC project is to shift the culture in that way, where underserved populations are no longer underserved, and we're providing a more equitable service across the board. And so if you could go to the next slide, please. Yeah, so simply put, we need to, when we reach out to underserved populations, we need to trust that those communities and those survivors know their needs best. Sometimes as practitioners, we can have the arrogant nature of believing that we know better than the communities that we're serving. And one thing that we found within the project is, you know, our communities are resilient. And we talked about that word resilience earlier. So whatever words you would like to fit in there, our communities know what they need. And if we actually build true, genuine relationship with them, they will tell us what we need once they trust, what they need once they trust us. And so building those trusting relationships is a key component to what we do. And we also trust the communities to say, hey, this is what we would like, this is what we won't, what we don't like. How would you like our organization to work with you? Not this is what we're offering you. There's a big difference between those approaches. If we could go to the next slide. So Katie and I are gonna discuss this last slide with you all. Some of the lessons learned, and again, we are in our second cohort. We're about halfway through, maybe a little more than halfway through the second and last cohort. And so we've learned a lot of lessons thus far. So number one, the importance of being nimble or flexible. This work causes us to have to constantly readjust our expectations. It causes us to constantly question whether we are doing these things for the right reasons, and if we're not, how to get back on track as an organization. We have to dig deep. This is tough work. Relearning how we approach people professionally and in community takes a lot of soul searching. It takes a lot of honesty, not just individually, but collectively as an organization. So it's deep work. And we definitely encourage our participants to be kind to themselves, but also to be real with themselves, right? Both are very important. We don't want to excuse behavior that can change, right? And then organizational shifts. So one of the interesting things that we've seen thus far is organizations that came into the project thinking, oh, we've been doing this for years, like there's not really a lot we can learn from this. Some of those organizations were the main ones that needed like top to bottom restructuring, right? And not in a bad way, but just to say, hey, we're looking at our practices, and we see that there are things that we need to do differently, right? And so being aware that, we all know about strategic plans and everything, but sometimes you may find you have to go away from the strategic plan to say, hey, 3 years ago, this made sense, but where we are in community right now, we're going to have to reevaluate. And so, Katie, do you want to take the last three?
Sure, I can. Thank you, Brooke. So other lessons learned is that I think, Madison mentioned earlier, like thinking about like that notion of community, and community can be your organization. So I just want to highlight that too. So when you're centering the voices of community here, that also means the community that makes up your organization. And so how do you center the voices of those on staff, I think is important. But also when we're thinking about the communities we're engaging from that 3-tier, how are you centering their voices? How are you collecting those voices? Is it just a survey that then sits in a strategic plan and a binder on a shelf, right? Or are we actually making good use of those things? Are we partnering with community, and are we allowing them to lead the work? Or are we going in and checking off grant objectives? I know I used to be funded in a prevention program, and there were a lot of those deliverables like 10% of people increase their knowledge by at least 15%. Is that really what the community wants and needs? They don't know. They don't need that. What they need is for us to listen and support their efforts, lift their voices, and allow them to lead the process. So those are really big lessons that have been learned. As a coalition, as participants in this process, we have learned that we also still have a lot of work to do, that we have to be continuous learners, lifelong learners, and that even though we're coalition staff, we are not necessarily experts, and often aren't. And so again, it's important for us to go to community and allow them to lead and collect their voices, and then do the jobs of uplifting them and funding them and supporting them. Yeah. I don't know, Courtney, do you have anything else to add to that?
I think I would add one thing, and that is the importance, the odd nature of like working with your funders on such a thing. When we're talking about culture change, also the people that you're partnering with, you have to be somewhat on the same page, even if the pace of change is at a different pace. Like at the coalition, something that we learned is that we may be able to be more nimble and dig deeper, but with our partners, the conversations might have to keep going, because they may individually understand where we want our agencies, our member agencies to go, but they also have barriers to face when they're trying to push these things down the line. So yeah, conversation is very important as a lesson learned.
Thank you, Courtney. Yeah, that also highlights, just again, conversation being incredibly important. A lot of our teams in the first phases spend a lot of time in conversation, and that has proven to be really rich for folks. And we had one organization actually decide as a result to level their power and decision-making processes in their agency, and that's been pretty cool to see too. Next slide.
I think that's actually the last slide that we have for you all, but I mean, I want to thank you, Courtney, Brooke, and Katie, for sharing about this project. I think that it's really neat to hear about a project that sets aside a full 2 years for folks to go through a process that ultimately will hopefully have a big impact on not just the ways that they engage with community, but like you said, I think, Katie, like the ways that they engage with community within their own organization. So we have a couple more questions for you all in just a second, but we wanted to also just turn back to our audience and ask, one of the kind of cornerstones of the UPLC project is centering equity in the work. And so what does it look like to center equity as a foundation of being trauma informed? We'd love to know what's coming up for you all, how you might be doing that, or how you're thinking that could look like. And Tori, I want to pass it over to you because I know you want to go back and ask our guests another question.
Yes, I do. Thank you, Ashley. So we have time to ask our guests one kind of wrap up discussion question just to leave today on kind of a high note and an envisioning note. So I'm going to ask that Courtney, Brooke, and Katie respond first, and then we'll bring it back to Madison. So we'll just work opposite of the presentation order. So same question for everyone. What do we need to sustain ourselves in the movement? What do you all need to sustain yourselves in the movement? Courtney, Brooke, and Katie, if you're comfortable sharing that with our audience today.
Yeah, I'll go first. So, yeah, I think that we are all feeling a high level of burnout. We talked about the Great Resignation earlier. I don't know who hasn't considered joining the Great Resignation. I don't know where the meetup group is, but I'm trying to find them. So yeah, I think that for me, longevity in this field and within advocacy as a whole, it takes a lot of personal grounding and recentering. I think that you have to be able to check in with yourself and figure out, what your own personal motivations for this work are. And without knowing that, it won't be sustainable for you. And there's nothing wrong with that because the work is difficult. But for me, finding grounding is very important. Vacations are important. Take your PTO. And so, yeah.
I'm going to go on and say community care. And when I say community care, I mean find yourself some allies that get it and are willing to put some, if you are a person with a marginalized identity, find those people who are willing to step up and do the work and give you some chance to rest, rotate out whenever you need to. Like Brooke said, make sure you take time off. And I would also say, like, work on them root causes. Don't shy away from them. If you got to put that at the center of your work, that's what you got to do.
Yeah, I mean, really just echo Courtney and Brooke is, take your time off, find your people. I think I heard a talk from Tarana Burke a few years ago, and she was really just like, find your people in the work, and the power of meaningful relationship and meaningful collaboration, and meaningful having a variety of definitions, but things that like feed your soul and move this work forward. So, yeah.
There we go. Yeah, I want to echo all of that. And I think one thing that has been helpful for me and also for folks that we've worked with and that sort of thing is also recognizing and owning our worth, within this Great Resignation, that we are valuable as individuals, as employees, as coworkers. And so recognizing that within that value there, we are then deserving of self-care. We are deserving of time off. We are deserving of love and respect. And that includes from the community that our organization is. So not being afraid to ask or sometimes demand that when the situation calls for it, through having that community of people, and recognizing that we have a lot of value and power within our organization has been really helpful for me just in the last 18 months.
Thank you all so much for sharing that. That was really inspiring to hear. And Courtney and Brooke, what you were sharing reminds me so much of the NAP ministry and some of the stuff that they post about how rest is our right, rest is resistance, and just how important it is for folks to really take that back from capitalism, take that back from white supremacy, and say, I have value and I deserve rest. And then I also really appreciate what all of you were sharing about finding your people and centering self-care around community care too. You know, we're not alone together in this life and in this work. So it's super important to find ways that community supports us and that we support community. Ashley, I'm wondering if there's anything else that you want to ask our guests or anything happening in the chat that you want to uplift.
Well, of course, Tori, I have lots of questions. I wish that we could just keep going. But I mean, I feel like we need to throw this question back to our audience. What do you all need to sustain yourself in this movement? You know, we started by asking, like, how do we fix this idea of a broken culture of work? But now, like, what do you need? What do you need today, tomorrow, in order to continue on if that's a choice that you want to make in this movement? So as we start to close out, we'd love to see what some of those needs are. I see rest and courage, the first thing. Thank you, Sarah, for sharing. And yeah, maybe we are asking everyone, this probably takes a little vulnerability. So no, you know, if you don't want to share, totally understand that. But I think if someone asked me this question, my first response is, I feel like I kind of need a lot. And I wonder if that's part of, you know, being really steeped in like capitalism and white supremacy culture, to think that my needs are actually like a lot when they're probably rather basic. So yeah, feel free to let us know as we close out. I want to take a moment and just thank our guests so much for sharing about the work that you're doing, the lessons that you've learned, these journeys that you have all kind of been on with other organizations, with your own organizations. I'm seeing more things happening in the chat. I see I need to work fewer hours, days and weeks without losing my income. I need a support group for survivors who do this work. I need a society to provide for basic needs for people. Yes, universal income, healthcare, childcare, to feel supported. Gosh, support and understanding. I mean, nothing that is coming up in this chat are things that we should not have and we do not deserve. So I hope that we are you know, through conversations and through action, we are building a future where we have these things and we can sustain ourselves. So thank you, Madison. Thank you, Courtney. Thank you, Brooke. Thank you, Katie. Tori, thanks for being my co-host as always. Thank you all for joining us. We had a big crowd today and really appreciate you all for sharing your perspectives and insights. I want to thank our captioners for being here and trying to get all these words down. And we just hope to see you on a future web conference. We have another one coming up in just a couple of weeks. And take care, everyone. It's the beginning of a new week. So I wish you all the best, and we'll see you soon. This will conclude our session for today. Thanks again.